exceptional, and it's important to teach good life practices, and we can see how Sabine Materlik, president of ATEM, she's a teacher in breathing and therapist, and the idea is to promote health in schools toward a future with healthy, strong breathing.
Meine Damen und Herren, ich begrüße Sie recht herzlich.
Ladies and gentlemen, it's a delight to be here and have the opportunity to talk about the work of our association and talk about what our members are doing. The area of our work is extremely complex and can be applied in many different situations. Diversity is life, and what I want to talk about today belongs to the area of training and health promotion and is directed at educational institutes. Breathing, which is what we focus on, is very important. It's very much been the case that the focus has been on growth in the past, increasing the length of life, but not much focus has been on the quality of life. The healthcare system really is becoming something where profits are put above people, and the pressure on performance is becoming increasingly widespread, and that's having an impact on young people. We're also seeing increasing sick days for people based in education, teachers and what have you.
Okay. I thought it was automatic. Klar zeigt.
So we're seeing a clear interaction between these various factors. When one group has an unhealthy lifestyle, such as teachers, and that they work interacting with other groups, such as students, they are directly affected, and that has a clear impact on their health. According to a report from 2021, the illnesses relating to respiratory infections was in third place, and that is something that can be attributed to the current pandemic, but also we see asthma, bronchitis, and other kinds of infections which are more widespread in the population than in the decades before. We're also seeing increasing mental stress being reflected in the illness figures of the report. We're also seeing blood pressure related issues in first place. The focus of the 2021 report very much was focused on the illnesses of young people. So the age group of 0 to 4 is subject to regular investigations. We see a high level of bronchitis there. Same is true in the 5 to 14 age range. 28% had severe infections of the respiratory passages, and that was very much linked to the pandemic as well. Atopic eczema and asthma were also highly represented, and there were developmental speech issues with 14%. For 15 to 24-year-olds, it was broken down into men and women, and it was particularly young men who suffered from physical illnesses, while psychological illnesses were prevalent amongst women. And in closing, I think we can conclude from the report that psychiatric and psychotherapy treatment of children from 2009 to 2019 increased by over 40%, or doubled if you look at it in a wider context. So we need to ask what all of this has to do with our breathing. Well, from birth, with our first breath, to death with our last breath, we breathe automatically every day, quite unconsciously, up to 20,000 times a day. And we take not only air into our lungs, but we enrich our blood and the individual cells in our body. We strengthen the nerve system and provide our organism and brain with all of the materials they need for a healthy life. And that influences our behaviour and our thinking. What's interesting is that breathing adapts to every new situation, constantly fluctuating in the relationship between breathing in and breathing out. The pandemic of the last 2 years showed us quite clearly the importance of breathing. There are no borders or walls in the air. We live in a single space on this planet, and everything that we breathe in every day comes from the world, from its organisms and beings. And what we breathe out goes back into that circuit. So we're very much linked through breathing directly to the rest of the world, and that's what our work focuses on. If I become aware of breathing and allow it to exist naturally, I can tap its potential. With conscious awareness of healthy breathing, I have the possibility of modulating it and achieving balance with myself, my environment, and that leads inevitably to a healthy lifestyle. And the approach using this awareness can help people towards a new path. That's something that was reflected in the project in 2021, where the impact of breathing was recorded over 2 years. And what we want to do is apply that learning to Germany as well. And the effectiveness of breathing has been scientifically proven. The question is, how do we spread that knowledge? So we've worked in the sphere of teaching and other areas where we've worked with children. That's the first thing. The next thing is, how do we actually communicate these messages in a way that is effective? Ultimately, we need to benefit children with this knowledge and support them in improving their health and lifestyle. And that's how the idea came to try to communicate this knowledge in a school environment, focusing on the health of teachers through their own self-experience and communicating the science behind it. They have, what this resulted in is a very user-friendly way of communicating this knowledge, supporting teachers and children on a day-to-day basis in school. And what we try to do is work to increase the awareness of the basis of good breathing, working together, for example, to identify the connection between breathing and health, breathing and balance. The exercises that achieve this are very simple, extremely quick to learn, and immediately applicable. And the training is based in 4 modules. The first one is the basis of breathing, which explains the fundamental principles behind breathing and makes them immediately understandable in practice. Second part is breathing in the classroom, and that focuses on the day-to-day actions in the classroom, the way people move, the way people sit. In the third module, the individual spaces of the body which move considered, and how they affect the breath is talked about. And fourthly, feedback. Teachers have the possibility of responding to what has been learned. teachers who are more relaxed at their work are able to bring a positive impact by communicating that attitude to the students they have. What we can then look forward to is integrating that very knowledge into the lessons that children are taught. Also, we're preparing a similar approach adapted to preschool and kindergartens. So I wish you all the best, and breathe well.